In 2020, USAID Uganda, in partnership with the Government of Uganda, launched the 5-year Strengthening Supply Chain Systems activity. This initiative, implemented by Management Sciences for Health in partnership with Advocate Coalition for Development and Environment and Uganda Healthcare Federation, is designed to support the Government of Uganda in strengthening its health supply chain system and ensure the sustainability of development outcomes. This was done through targeted improvement along the public health supply chain, advancing good governance, and increasing local capacity to solve supply chain challenges to ensure continuous availability of quality essential medicines and health supplies, and thus foster a sustainable, accountable, and efficient health supply chain system. Before the activity's intervention, the health supply chain system faced numerous challenges, including frequent stockouts of essential medicines, inadequate planning and delayed ordering, theft of commodities and fragmented systems, limited resources, and accountability gaps.
We did a survey and we had almost $2 million worth of commodities expired in the health facilities we surveyed, and there were only 1,300.
We used to combine all those order forms and send it to national medical stores. Sometimes they could even say, "We have not seen your orders, but you sent the email."
Consolidating these orders was very difficult. Almost each program had its own ordering portal.
Despite increased funding, the availability of critical medicines in health facilities was below 60%, far from the national target of 90%. In response, the Strengthening Supply Chain Systems activity set out to transform the situation by strengthening the supply chain for health commodities, planning, budgeting, procuring and distributing essential supplies from central warehouses to local health facilities up to the patients. With the activity's technical assistance, 1,351 computers and networking equipment were distributed to 765 health facilities and district vaccine stores with support from USAID and the Global Fund.
We received 3 computers, so you're able to track and know which drug is running out, which one is expired. So it is very easy for us to monitor our stock.
Facilities with an electronic logistics management information system increased, and currently 45% synchronized stock status data for 3 consecutive months into the National Health Data Warehouse for real-time data sharing and tracking. Facilities reporting on all commodity categories in the DHIS2 system increased from 13% in 2020 to over 80% from 2023 onwards at both national and sub-national levels. These results are visualized on the online facilities stock status report dashboard for real-time inventory monitoring. The Ministry of Health institutionalized integrated quantification of all essential medicines and health supplies in the financial year 2023-2024, moving away from silo quantification and planning. Key policies and guidelines were developed, reviewed, and updated in collaboration with various stakeholders. The 10-year Health Supply Chain Roadmap was launched on January 20th, 2022, aimed to localize and transform Uganda's supply chain systems, making them more efficient and sustainable. The roadmap leverages investments from development partners and local financing, enhancing the government's ability to independently manage the national health supply chain. Ministries, departments, and agencies incorporated supply chain priorities in their work plans and budget, leading to increased funding of essential medicines and health supplies from $109 million in the financial year 2020-2021 to $173 million in the financial year 2023-2024. 657 health facilities were electrified. Over 380 facilities were connected to the national internet grid. 1,375 districts and hospital leaders from 72 districts, cities, municipalities, and 34 hospitals were trained in supply chain leadership, management, and governance. District ICT officers were recruited to maintain electronic equipment.
We not only receive computers, we also received the capacity building to help us be able to use the equipment.
and a state-of-the-art warehouse was built to handle health supply chain processes. Now, there is better visibility, tracking and tracing of commodities thanks to the National Data Warehouse.
Thanks to the pharmaceutical information system, we are tracking matrices, including how much of the expected records are we receiving, which facilities are reporting, and this has facilitated targeted response to places that need support.
Districts are now including health supply chain priorities in their annual work plans and budgets. Looking ahead, the Ministry of Health will prioritize expanding the digitization of the health supply chain to more facilities, further enhancing local partners' capacity and ensuring the resilience and sustainability of Uganda's health supply chain. By integrating local financing and investments and strengthening the government's ability to manage the national health supply chain independently, the government of Uganda aims to solidify the progress made and contribute significantly to Uganda's journey towards self-reliance in healthcare.